Got it.
Morning, Stroke Warrior, and TBI survivors everywhere. This is Stroke Warrior Radio, where we share our stories of resilience, recovery, and advocacy from stroke and brain injury survivors. Today we have a special guest, Cara Sullivan. Hi, Cara. How are you?
Hi, I'm good. How are you, Ralph?
I'm doing well today. You're a nurse practitioner, mother, epilepsy survivor who faced a life-altering decision, I see, a brain surgery to remove a tumor causing seizures, knowing it carried a risk of stroke.
Yes,
I thank you for being here. Can you walk us back to 2009, that first seizure, and what led to that diagnosis?
sure. I was working nights as a nurse and realizing it later and after I was diagnosed, the nights and the lack of sleep and all that interruption could definitely bring on seizures. So I had this very strange episode. I kind of smelled something in the environment that wasn't there. So there was something else, like a feeling in my chest, and combined with all those symptoms, the neurologist later told me that's typical temporal lobe epilepsy. So before I got to that point, I sought you know a visit to my primary provider, who did an MRI, saw something on the MRI, sent me to neurology. Neurology said, okay, there's a tumor, there's the seizures. The uprising of where the seizures are is where the tumor is. So medication was the first intervention. Over years and years later, as things were progressing, and the one medication wasn't really effective enough to keep the seizures from not happening, a second medication was prescribed. And with that, naturally, come symptoms, but it was better managed, but still not perfect. So then there was, when you want to get to that, more increasing events from like 2024. So
How did the diagnosis affect your life and work you worked in ICU, right?
I worked in the cardiac surgery ICU. My
Wow.
seizures were more like silent seizures, like really if I was experiencing something, nobody really would know. I didn't lose consciousness. I didn't have any altered consciousness. So it was more like they're called simple partial. So I stayed conscious. And if nobody knew that I had this history, they really wouldn't even know. It didn't affect my work. I was still getting to work. I was driving because it wasn't affecting my consciousness.
Right.
So it was just, this medication for a young enough person to start taking with a diagnosis, another diagnosis added to their chart. But it was something I needed to do because it was help controlling them from making them,
Yeah.
worse and more frequent.
And it took about a decade. You navigate while you were going through all that. You navigated motherhood, grad school, a demanding career. How did you manage that while living with a brain tumor under the surveillance you were under?
Right. I have an excellent husband, a very supportive husband, very supportive family. Um, we had to go through some fertility treatment to get pregnant, and that worked out. And I had my daughter, 2015. And my family, my in-laws, who I really call more of my family, were very they're helpful people. They're the type of people that are the givers of the world, and they stepped in and they helped. And I have two nieces. Um, and everybody was just very helpful. I was working in order to be successful with school. I needed to switch my schedule to work more weekends and have more of the weekday free in order to attend classes, do clinical hours. So unfortunately, I was away from my family on the weekends at times, but it managed to get me to the successful outpoint of basically my degree and um, having my two kids. So yes, very, very
Okay.
supportive husband. Through graduate school, my husband was a big help and
Great.
just gave me the time I needed to do the schoolwork when my kids were little, like I said, so they were still napping. So their 2.5 hour nap, I jumped on the computer and wrote my papers or studied, or I had to find
Nice.
all time and any time in between everything else.
let's talk about 10 years later, or actually
Hmm.
it's a little more than that. The decision to undergo finally brain surgery. What happened to bring you to that?
Yeah. So, like I said, the seizures were sort of not becoming as well controlled, and I was increasing the second medication dosing for the doctor, and she was kind of aggressive, to say you should see a neurosurgeon. So in the spilling over from 2023 to 2024, I had an event with my family, my mother, and she really needed, I had to get thrown into her life to really help her significantly. And it was very stressful. And she's in Florida and I'm in New York. So it was long distance and a lot of my time dedicated to helping her through social workers, through Medicaid. It was a lot in addition to working, family, and everything else. So I think, like I said, with seizures, there's the seizure disorder itself, the epilepsy, which a lot of times people don't even know why you have it, but nevertheless, I had this brain tumor, so that was the contributing. Stress can affect anything and create, throwing off homeostasis of your body. So the stress of it was increasing the seizures. The sleeplessness or the interrupted sleep nights was affecting it. And they were becoming more and more frequent and more severe in severity. So I would have them at work. They'd have to, send me to the ER, and I was having more and more. And then eventually my doctor said, you can go up on medication, but they come with side effects, and it's not a given that it's going to control them. And it wasn't controlling them well. So it's not what they call intractable, excuse me. Like it's completely not controlled, but it was nearing that state. So then she decided this intervention, send me to the surgeon was the right thing. So when I
Yeah.
proceeded with the surgeon, he
What? Go ahead.
when I proceeded with the surgeon, he said he basically was confident in saying, this is what I do. You'll be fine. Yes, there's these risks. But this is what I do. Like this is my job. Like a plumber's a plumber. He's great at it. He's great at this kind of thing. And I mean, yeah, I walked out and I felt like, okay, I heard stroke, there's other things I heard. And I mean, it's like devastating, right? If that happens. So I was having a hard time. I was talking with my husband. I was really having a hard time with like feeling like, well, what's the worst of the other? You continue to have seizures, epilepsy. That in and of itself can cause sudden brain death. Your
Yeah.
brain is experiencing this irregular activity, and it could be all over the head and the brain. And there's nothing really. If you're alone, there's nothing that could just stop it. If you're alone, I wasn't driving, so that wasn't an issue. But if I'm alone or with my kids or whatnot, I mean, it could result in sudden brain death or irreversible brain damage. And you don't know, just like now I underwent the knife and I had a stroke, but you don't know how you're going to recover, how long it's going to take, what it's going to take to recover.
Yeah. I'm curious. I mean, working in ICU, I mean, you've dealt with those kind of patients before. What were the biggest fears or risks that you discussed with your medical team? I mean, you had to be aware of a lot of them. What was that like?
I mean, naturally, any type of surgery comes with like bleeding risk, infection risk, but the stroke was really the biggest risk. So here I'm, thinking, what am I going to do? What would you do? The next reasonable, rational person, like, as many people as I talked to about it, they said, they would do surgery. And the second you start like asking your friends, your colleagues, you get too many opinions. That also isn't a good idea. So I just had to brace myself and say, if, the thing that really pushed me over the edge was like, he said it's nearly curative of the epilepsy, removing this tumor. So that I think would push me over the edge to be like, well, there's that. Yes, there's a risk of stroke, but if it essentially could be curative, you could be off medication, you won't, you could drive again, like it won't interfere as with your life.
Oh,
So that I think definitely pushed me over the edge to make the decision in conjunction with obviously talking to my husband, and everybody was on board, supporting my decision.
and it
So
worked.
it got rid of the
Post-surgery,
tumor.
though, and post-surgery, you realized something wasn't right. Can you describe the moment that you told me about in your MRI machine?
So my first memory of waking up, the MRI machine emits a lot of noise. So I'm hearing this noise and I'm in this MRI machine, where you're enclosed, it's dark, you can't really, you're not supposed to move. And I know the noise and I know that I'm in there because I've had serial MRIs over years. And I was like, why am I here? What's going on? And there was no way to signal help. So I was trying to move my feet, thinking like, oh, if I'm moving, they're going to come in because they're going to say you can't move. Pictures aren't going to be clear. So for what I thought I was moving, I guess I thought I was, but I wasn't, because I obviously had the stroke, but I didn't know it then until I returned to the ICU. And one of the doctors told me, and I was still like in a fog because I was still waking up from anesthesia, half, groggy still. It's nighttime. I'm in an ICU. Like it was all a foreign environment. And until I really realized, oh, I can't move my left side at all. And I'm speaking, different. My mind was there though. So I was confused at what happened, but I was still clear enough to be like, okay, I'm in the hospital, I'm in the ICU.
But
Yeah.
then
And
you
then
went to,
I had
then
the
you
anxiety.
had to hear from the doctor that you had a stroke. What was that emotionally like?
I mean, to be honest with you, I don't even really feel like I remember the point that they came in, they told me. I remember talking to my surgeon, but I don't really remember. I feel like I remember more when my husband came in and like told me what happened, because when he got the whole story, he kind of reiterated it to me. So
Okay.
yeah, my poor
His
husband.
his his reaction from your story that I've seen is it was pretty darn moving. How did his support and your family shape those early days of your recovery?
Yeah, my poor husband, this devoted man with two children at home, and knowing what I was going through, got a phone call, we think she had a stroke. She's not moving her left side. He comes, to the hospital. We're going to do an MRI in the morning. And then he comes to the hospital and hears all this. And he was obviously like devastated. And until he came to my bedside and saw me and talked to me, he was so scared for what he's going to see. Am I going to be me? We all know strokes affect everybody differently, and people, they can't speak. They're just a different person. They're not them anymore. They're a shell. And here I was laying in bed and I was talking to him, and I was me. He knows me well, so he knew I was in there. Yes, I had physical deficits, clearly, but he knew I was me and he could work with that. And he was okay with like, unfortunately, this happened, but you're still Cara. So yeah.
That's amazing. You spent 91 days in acute rehab in the hospital. What were
Hmm.
some of the toughest and most triumphant moments during that time?
That was a tough time. I honestly came home. I thought I was going to have like PTSD, but I didn't. It was tough, especially as a healthcare professional. It was tough. And I was in a room, and my only access was a call bell to get help. I couldn't get out of bed myself. I couldn't do anything myself.
The
You
whole
know,
time, the whole 90 days?
not, I mean, like right at the end,
Yeah, yeah.
not, until like the week or so before, I was moving around in a chair and using my right side to push with my hand on the wheel and my foot, kind of like the Flintstones, where you move, your foot underneath. But ultimately, yeah, I couldn't really do anything for myself. And I got through it, I think, a few reasons. First, I sequestered help in the evening. The evening was the loneliest time, from like 5 to 8 p.m. It was lonely. There was nobody around. I was in bed at 5, 6, 5 o'clock, 6 o'clock at night. And I don't really watch a lot of TV, and it was just straight TV. And like I had a roommate at one point that was watching Law and Order on repeat, and it was, you can imagine, it's depressing. And I'm just like, I can't do this. So I sequestered and I made like I made sort of like a list, like, okay, Monday, this person's gonna come and spend with me from 5 to 8 p.m. because 8 p.m. was visiting hours. And then at 8 p.m., like on the dot, I got all my medications. I said bye to my friend, my family member, my husband, whomever it was, and I went to bed. I went to sleep. And that was my saving grace in a way, because it was very lonely and it's very like depressing. And I read the book, why the bad things happen to good people. And, I was really having a hard time. And it was hard enough to read with my vision changes also due to the stroke. But having that was good. And then, you'd go into the rehab gym and you would see patients younger than me in worse condition than me. A lot of people had trachs. And then there's also when I would eventually be able to navigate a little bit around the rehab hospital, because I was in that chair and I was able to move myself a little, although it was exhausting. I would go down around like the lobby and you would see the other patients on other floors, and they had a spinal floor. So these patients and adults are paralyzed. And, unfortunately, I had this happen, but I
Yeah,
say, unfortunately, had it happened, but fortunately, so much was spared. My dominant side is strong. It wasn't spared. My mind, my cognition, my memory, I'm there. I'm sharper, like I said, because I don't have seizures and I'm off one of the seizure medication. I'm still on one, but I was on that for years and years and years. And it's still there just to prevent anything else from happening.
precautionary, yeah.
Yes. So, but I was at least grateful, because obviously showing gratitude helps you as well. And I was grateful that I had all that spared. I'm still me. My mind is sharp, my memory, all that. I can have a conversation. I'm not aphasic. And my
Well,
dominance is spared.
you brought up depression, and one of the things I went through early on in my stroke recovery was they didn't tell me about the mental health part of it, the depression. While you were in rehab, did you get any counseling, or did you seek it out, or did you realize you even needed it?
I did get some counseling. They have a like psychiatrist on staff that came, and then they never put me on anything, but subsequently
Okay.
thereafter, the social worker would come visit me weekly for a few weeks. It wasn't like the length of the 3 month, but they also have a, what's her title? She's a rehab, but she's, a recreational rehab
Yeah.
therapist. So she brings them in, she does the craft, she runs the bingo, she does all the recreation. So she sees the patients in the hospital and comes to their bedside as well. And believe it or not, she was more instrumental in just opening my eyes to, but you're here and your beautiful kids come and they love you and they need you. And, it got me through. My daughter and son came on the weekends with my
Okay.
husband naturally. And um my daughter drew me, I had pictures like all on like the bureau that was like right opposite the foot of the bed, and I would look at them. And at one point she drew me a heart and she colored it in red, and I had it on the bureau at the foot of my bed, and I would look at it in the mornings, and I think with the light shining through, it looked like it was beating. And I would think that's my kids. That's like, I need to be there for them. Like, imagine their lives and my husband's life. If I didn't come through, their lives would be changed forever. And I can't stay in this state of, feeling sorry for myself or having these, thoughts and things. I need to propel forward for them because their lives would be incredibly different.
Yeah,
And
that's one of the things that so impressed me about your story is that you're so motivated by family. It's amazing, the love and the support that you give to each other, actually. I mean, yeah, I'm sure you supported your husband as well with all he was going through.
he was going
Having,
through a lot, yes.
yeah. How did it feel? What describe the day that you walked out of rehab with a brace and a cane, and what milestones did you reach after that?
Yeah, it was amazing. I mean, they put a brace on my leg from my foot. It would sit in my shoe all the way up to the top of my leg to my hip.
Oh my gosh.
Oh
Wow.
yeah. So that's how I learned to walk. and I had a quad cane, which is like, cumbersome, kind of heavy. But I walked in rehab like every day in my rehab, and then I did occupational therapy with my arm and hand too. But when I left, yeah, the fact that I could do that, and then I got in the car, I was able to just get in the car, and I got home, and we utilized a wheelchair a little bit and a little bit here. Like we have chair lifts on the stairs. So with a combination of a few things, I got in the house. I was able to get all around the house, the first floor, the bedrooms, the basement. So I felt like, okay, I'm getting all around my house to wherever I need. And especially being away so long, 3 months not being home, I wanted to, see my house again and get reacquainted with my house a little bit too. So the brace, was on, and then it locked the knee. So your leg was completely straight. And when I walked, I had to walk and like sort of circumvent my left leg around. And it is naturally, it's a little awkward, but that's
Yeah,
how you learn to walk in rehab. So once I went to outpatient rehab, within like 6 weeks, I got it cut down to just right below the knee. So it was much less cumbersome.
nice.
And I ditched the quad cane because it really looks like a sick person using it. It's very cumbersome, it's heavy, it's unattractive. So
Yeah,
I said, I'll just get a straight cane. And I used that, and I had the brace. And then I was still going to the outpatient rehab center where I was an inpatient. I was now going to see my therapist there in the room for an hour and then go home. And she would take the brace off and do some therapy and whatnot without it, obviously under her care and direction. And I was doing my own things at home. And slowly but surely, I said, let me leave the brace off for a few minutes. And I would put my sneakers on and, just putter around the house, whatever needed to get done. And then I said, you know what? And my closet in my bedroom has all my shoes and my clothes. And I'm just like, let me try those really comfortable Crocs I have that I wear like around the house, as slippers essentially. So I've been in the slipper Crocs and no brace in the house. And when I go outside, I absolutely use the brace. I use the cane on the street and stuff. But, little by little, I'm doing my own rehab naturally because I'm done with the outpatient. Insurance only covers so much. Thankfully, they
right.
covered that much, which was great because I got a lot of therapy and I got very far in my recovery so far.
That's great. That's
Still a
great.
ways to go, but I got far.
Yeah, well, it's one of the things we say in our actual catchphrase for the Stroke Warrior Radio is catch the wave. Warriors achieving victories every day. Everything you've described, you recognize those little things the whole way, which is
Yes.
amazing to me. I didn't learn how to do that until I was 6 years. You
Yeah.
know, that a lot of doctors and therapists told us early on, this is good as it's going to get. And that's a
Yeah. That's
bunch of
unfortunate
malarkey.
they say that. I've had a
Yeah,
therapist say that to me too. What if your arm it doesn't recover, and it's like, well, I can't accept that. I have to keep at it. But yeah,
yeah.
I still have, I still have, a ways to go. Mm.
You shared with me that you go to the gym 3 times a week and actively involve your left side in daily routines. And
Yes.
as a lot of us know, consistency and repetitiveness, you achieve those victories. Tell us about your at-home strategies and resilience that may help another survivor.
Oh, yeah. I have a whole list of things that I do, and mostly the home things are two things: a lot of stretching and range of motion. Because you can imagine for areas of your body that you're not using, you don't have voluntary control over, the muscles get very tight. And especially while you're sleeping, you're not really moving as much. And so I have to do a lot of range of motion, stretching my arm, my shoulder, um, and a lot of using my unaffected side to hold up my affected side and um, stretch out, across the table, or even in bed, just raise my arms over my head and stretch. And, even just to put your arms at your side, sort of like that. Takes a lot of
Yeah,
effort, but it helps with all the muscles in your shoulder, your chest, your arms. So yeah, that's a big thing, all that range of motion. And then there's resistance bands that are used common, and you put those around like your ankles and it can strengthen your ankles, or you put it around your thighs and it helps when you do like squats, so there's some of those exercises I do at home daily, along with just step ups, like going outside, holding the rail on the right side, stepping, with your affected side, then your unaffected side, kind of stairs, but you go forward and back, forward and back. And
Right.
eventually I want to try not to use the railing, but you have to do these things like every day. Consistency and repetition is everything that they ever said that you do. And involving your arm is also important. Like you have to recognize, your brain has to recognize it's still here. Like, let's wake up, let's wake it up, let's get the pathways going, let's establish new pathways, and let's involve it as much as we can. So that means using my unaffected hand to wrap around a bottle top, like a salad dressing bottle, a water
Right.
bottle, anything that I can just grab with my left hand to open with my right. Even like just the toothbrush, the toothpaste, holding laundry underneath my arm and pressing my arm to my side, so that the laundry won't fall. And you can imagine the amount of effort it takes just to walk across the room and hold something. Your brain has to focus in two places. And oftentimes, if I'm walking across the room and I'm trying to hold something in my left hand, even just like a magazine, it could easily fall out. You have to really put a lot of emphasis and thought to the one task or both tasks. So the stronger your walk becomes, you're not as much focused on that because it's like involuntary. It's basically something you're doing on your subconscious level that you've done for your whole life since you were able to start walking at 2-3 years old. And now you're trying to hold something in your affected hand, and your brain needs to focus there too. So it's trying to do two things. It becomes complex, but that also is what speeds up healing, I think.
Yeah, it
Speeds up the connections.
Yeah, your recovery today, I mean, you can hold the magazine longer now than you could 6 months ago, right?
Absolutely. I couldn't. 6 months ago, my affected hand was in a fist, balled up in a fist. I couldn't even open a finger. Not at all.
And how's it today?
It's more relaxed. It's not balled up, but I cannot just open the fingers all the way. The relaxation of it, as they say, takes more effort and more time and more work. But it's loose enough that I can, again, using my unaffected side, open the fingers a little, put something in my hand to hold it or squeeze, and I could squeeze my fingers. So I can, if you make a fist, you're holding something. Yeah, I can hold on to it. So I use that to my advantage to squeeze the toothpaste out, or, hold a bottle again and be able to open it with the right hand. So I use that to my advantage. I also got Botox injections, which help to relax the muscle. Yeah. So the Botox, the same thing people use on their face in various parts to relax wrinkles. You use it in the muscles that are very tense and tight, and it helps to relax them, and hopefully with the goal of gaining more movement while you're doing your therapy. So I've had that 2 times in various places in my left arm and my left leg.
Wow. Yeah, I know a couple people that have done Botox. I never had that, but
yeah, it's not a quick fix. It takes time and it doesn't last forever. But in the interim, if you could relax it enough, you can get more range of motion and maybe more therapy and movement while you're doing therapy or in-home activities.
For a number of years, I didn't have a lot of hope. Where did all the hope that you kept manifesting come from?
Because with a little hope and a little faith, anything is possible. Keeping that hope or that faith, is mental resilience, is doing things in the face of being exhausted, being just mentally exhausted, physically exhausted, but doing one more set of something is mental resilience. Because I can ask, and I can say this right here, you don't know what exercises or what therapy you're doing today, how it's going to help you tomorrow, months from now, or years from now. But if you do nothing, you know for sure that you're not going to improve, or nothing is going to move
Yeah,
forward.
we call that here deciding to be a stroke warrior instead of just a stroke survivor.
Yeah, you have to thrive. You want to thrive in your life, right? Everybody
Yeah,
wants to be thriving.
exactly.
So yeah,
There's a lot of survivors struggle with identity as a stroke after a stroke. As a nurse practitioner in cardiology, how's this journey changed your view of patients and healthcare?
well, I know for a fact I definitely have more. I think I had a lot of empathy to begin with, but I definitely feel like I can offer a lot more, and I can offer and hopefully give hope to people who are struggling. And if it's not the patient because they're unable to just talk, depending upon their condition, at least directly to the families, that will in turn be the caregivers eventually. Um, yeah, I mean, and also having my own, although I've been in cardiology in my, 20 plus years in healthcare, 25 years almost. But I know a lot about neurology now as well. And I feel like I could also, I probably can assist with some support groups even in that realm. When I do return, I'm not sure exactly if I'm returning to my job or another area of cardiology, albeit something that might not be as physical. It just depends upon what the institution, the supervisors, that powers that be have in store for me.
Yeah,
But I welcome whatever I can do, hopefully within the cardiology realm, because that's where my passion is, my experience is. And also, when I was in rehab, they would have nursing students come in because that's how they learn too. They learn on the job. They learn not on the job. They're not on the job yet. They learn training, and they put clinical hours toward people in facilities, whether it's hospitals, acute rehab. So they would all come in, and the instructor, would say, okay, so they would all kind of come in, and I would tell them about my history and my things. And here I was, quizzing them. And the instructors like that because they would feel like, okay, if you go to, yeah, you'll learn a lot in her room, And oftentimes when you go to doctors, like I have doctor's appointments that are in large medical facilities, resident facilities, so medical institutions that have residency programs where doctors are learning, starting from graduating from medical school and now their first year intern to then resident, and they all have to learn, and they'll have to go through whatever they need to go through in order to get to their specialty of neurology, neurosurgery, whatever they may be. So here I am in the room also as the doctor comes in. Is it okay if I bring these, 6 residents? Sure, everybody needs to learn. Come on in. And here I am. Also, you know,
yeah.
I don't claim to
I
have more education than a
A
physician.
lot of us go through stigma. Um, for example, I didn't want to go out. I didn't want people to see me like that. Do you
Hmm.
think that has changed you at all, with
Most
patients?
definitely. Most definitely. In the beginning, I felt that way. I started to do it and I was okay because I wasn't around a lot of people that knew me before. But from all the people that knew me, pre-stroke to now, I do feel self-conscious still because I don't feel like I look like I did, even though I think 90% of me essentially looks like I did in my face, at least in the symmetry, but there's still, things that I notice. So yes, and especially returning to work and being around people who knew me all those years, knew my pre-stroke
Yeah,
life and stuff. Yeah, it is gonna feel kind of like, I don't know what, shell shock, culture shock, like shock, definitely.
yeah, yeah.
But
How'd you get through that?
I've seen a few friends along the way. I've obviously spent time with family, so that's already, family is going to accept you regardless, be there for you, support you. So that was like a nice, good thing. And then the recreation therapist from rehab, was ringing in my ears, like, you got to get out there and continue, socialization because that's part of healing and a healthy lifestyle too. So I've been sporadically, seeing friends too, and more than anything, they're always saying, "You look so much better. You look great. You're healing. You look great. You're getting better. It's amazing. You're a miracle. You're inspiring." So like, how do you feel any other way but good? So
Yeah.
they're
Yeah.
accepting. If they're a true friend, they're accepting of you.
You said a little bit earlier about after the removal, tumor removal, that your mind is sharper without seizures than a tumor. And that's, wow, that's powerful right
Hmm.
there. I mean, with the epilepsy. Tell us a little bit more about your shift in clarity.
Well, I noticed, I think when I was in rehab, or definitely when I came home, and I said to my husband, I feel sharper. He's like, he said, yeah, well, you're like weaning down off that second medication. And yeah. And the tumor itself had a lot of electrical activity, irregular electrical activity surrounding it. So there was always almost like a low level of like seizure activity constantly. And and in the area that it affects memory, it affects sharpness, I think, as well. So I just felt like the joke kind of at home was I would be reminding my husband, my kids, like, okay, do this, oh, what's going on in, school and this, and oh, I came home December 11th, so it was 2 weeks before Christmas. So then we're trying to plan what are we gonna do, and my husband we celebrate as a family together. What are we gonna do? And the running joke in the household was like, I had the stroke, like I was the one organizing things and doing things and reminding people of things. And here I am saying, wait, I had the stroke? Like, so yeah, my mental clarity was there for basic small things all the way up through self-reflective things and medical things and healing in my journey in that way. And also can imagine all the things you need to do for like returning to work and filing this paper and that paper and just
Yeah.
staying organized and on top of things. And I was always organized and on top of things. So that helped. Fast forward up until, coming home to now, the 6 months, 7 months later, that, yeah,
Yeah. I
it
I
helped
found
also take a burden off my husband a little bit. So if I'm there and I'm sharp and he's doing more of the physical work too, because, I don't drive. So he's going to the store and doing all the errands and that kind of stuff and picking kids up and running here and there. And then like my mind could focus on what are the kids going to do? Like we need an activity and their summer is coming and then they're in camp, they're doing things. We had that set. But again, we had that set because I was also propelling the things forward. And I've
nice,
always been
nice.
more of the planner of the, you know,
Did
rela-
you did you find it took me a few years to realize to that I should continue doing the things that I did before my stroke? And for example, um, taking out the garbage, it was way different before the stroke. And it took me a couple of years to realize, hey, this is something I got to do. Go do it. Did you find that re doing the things, whether they look pretty or not, that you did before became better and better every day?
well, I think it's the kind of thing too, where if I was off from work before stroke, off from work and everybody left and I'd turn around and look at the house and be like, okay, I need to do laundry. I need to clean up this, straighten up this, straighten up this. And my husband would come home and I'm sitting on the couch. I'm like, yeah, I didn't do anything all day. And he's like laughing, like, I know you did. Like, obviously, if you don't do anything, your house is going to look like a dumpster fire. But yeah, so I do try to get back to the basics again, like, you run the dishwasher, you do the dishes, you put this away, you do this, you do the laundry. But also, my kids have stepped up a lot. And this is a great opportunity to teach them, hey, let's bring your laundry baskets downstairs, sort them up, put them in the washing machine. Watch, this is a new washer. It's amazing. You could see through it. Look at how it spins. It's so cool. And it gets them involved. So they've stepped up to helping with the dishes, to set the table, to clean up. They've really stepped up and gotten involved. And even just to help me with basic stuff, hey, may you please fill my water cup? Can you help
Yeah,
me do this or put this? Yeah, simple things. So it
okay,
definitely helped them step up to being
nice.
part of the routine.
Tell me about your recovery these days.
So these days I know that I have a certain amount of time before I need to return to work. So I also know I need to commit to my at-home activities as well as the gym. So my husband is working back to work full time, which means I'm staying in the house myself, which is in and of itself impressive, right? So we plan, what am I going to eat like for lunch? We're all home at breakfast. What can I eat for lunch? Okay, I can have this, this, and this. And whether we prep it the night before, like I'm all prepared. I can get up and down the stairs on the stair chair. I can get around my house. So I'm home. I'm home alone. So I'm doing that well. And I need to make arrangements to get to the gym. So whether it's a ride from a friend, also where I live, they have a bus that can take disabled people from place to place, from like a curbside pickup. So I've enrolled in that, and I'm waiting to get my, applications surveyed and get my approval and card and, ID and stuff. So once that rolls around, I can get that up and running and say I'll get to the ride to the gym. The gym is 15 minutes away, but if I don't have a ride, I can't get there, whether it's a friend, family, or the bus service. So that's something that I'm doing as well, incorporating. And like, while I could do a lot at home, you need to get out, you need to get out of the house, and you need to go somewhere else. You need to see people and socialize with the people when I walk in that say, hi, how are you? And you social, and you're also utilizing your community resources. The gym is at a community center, which is part of, you pay for your taxes. So you go in there, you show proof of residency, and you get a card, and you walk into the facility, and you have, my kids. So my husband will come pick me up after he gets the kids, and the kids run in, and they know them, and they run to the gymnasium and play basketball. They run to the other room and do ping pong. They run down the hall and chase me down to find me in the workout room. So yeah,
Nice.
it takes a village, right? Yeah.
Yeah, exactly. A little bit of closing questions just to get to know you a little better. What's a song that motivates you?
It's funny because we've been, my daughter made a Bluetooth speaker at camp. So we've been putting together a playlist, and we have a lot of songs of like female artists, like Pink, Try, you got to get up and try. Other artists, the song Brave by Sarah Bareilles. And my daughter came and told me that one like some months ago while she was still in school, and really enjoyed it. And it gives a great message. So I find female artists and songs that are inspiring in and of themselves. And then some other things that I probably listened to when I was her age, that, your hair bands and some things like that. And kind of getting into some like guitar riffs, things that can, not slow stuff, but something that's really gonna amp you up a little while you're exercising or something. Yeah.
Every day when you get up and you're having a good day, what's the first thing you grab? Crocs, brace, or cane?
Oh, my Crocs for sure. I get up, I have all my stuff prepped, I'm gonna get dressed and whatnot. And yeah, until I'm gonna go outside to go to the gym, to go somewhere on the, errand with my husband, kids, whatever. No, I get the Crocs, and I walk around with those in the house.
Cool. Your favorite post-rehab treat that you give yourself?
Well, it's funny, when I was in rehab, the food was so awful that my husband would get food, and I find I gained weight, and they were weighing me, every day. And I didn't eat much afterward because I couldn't eat after the surgery. They had to make sure I could swallow well. So I wasn't eating well. And then what I was eating, it was like cat food, basically, like the puree consistency. Yeah. So I think I lost weight after the surgery, and then immediately, put it back on. So the treat, I think, for me is just finding time with, the friends and family and gathering together. It's not necessarily a physical like food treat, because I need to focus on, more healthy lifestyle too. So
it's a social, that I love that one. I like that one a lot.
I have plenty of sweet treats I enjoy, but those aren't, those should be a thing of the past, and in very, very sparse quantities.
If you could give one message to another survivor facing brain surgery, stroke, what would it be?
And the main message is, it gets better. It doesn't stay like this forever. This too shall pass. It's kind of cliche, yes, but it is true. It's not going to be like this forever. With the love and hope from your family, in your own, internal hope and faith and love of yourself, and patience with yourself, and putting the work in. And that's where the hope and faith comes, that one day you will see the results, and they'll just come to mesh together. And it's a lifelong journey of working hard toward it and doing it every day. And don't ever let anyone tell you you're going to plateau or this is as good as it's going to get, because that's not the truth. Nobody knows. Nobody knows that. Nobody can say that.
Cara, anything you want to add today?
I don't know. I think your questions were very specific and good and thought-provoking, and really came out to display and show really what a stroke warrior can go through.
Awesome. Cara, thank you for showing us what fierce resilience looks like. I mean, you've gone from a nurse to back patient, and now you're getting back again to a nurse and a mother. I mean, it's amazing to me. We can't wait to see you get back to cardiology and thrive there. You are a true stroke warrior, and I thank you.
Thank you.
Bye now.
Bye-bye.